Go.
Hello, my name is Asia Anthony. I'm a nursing student here at the University of South Alabama, and today I will be performing my NG checkoff. So first I'm gonna have my person scan the room. Okay, so first I'm gonna come in and I'm gonna verify order and check hospital policy. And then I'm going to perform hand hygiene, and then I'm going to use two identifiers to identify my patient. So Jaguar Jones, A2563, A2563. Then I'm going to assess for allergies, so penicillin and penicillin. Then I'm going to explain the procedure to my patient that today I'm going to be placing their NG tube, and then I'm going to provide privacy. So next, I'm going to gather my materials, and then I'm going to don my goggles. And then next, I'm going to get ready to position my patient to a workable height, and I'm going to put them in high Fowler's position, workable height, lower the bed rails. And then I'm going to begin auscultating for the vowel sounds, and I'm going to begin assessing their oxygen saturation and vital signs. And I will also state that if there is a decrease in oxygen saturation or vital signs or any sign of respiratory distress, then I would stop trying to insert the NG tube and not continue until they have been stabilized. So next, I am going to establish a Q sign between me and my patient. So this is going to be my Q sign. And so then after that, I am going to get ready to open my saline pump. And I'm going to verbalize that I would put a drop of water-soluble lubricant there for the inside of my NG tube. And then next I'm going to get my syringe and I'm going to loosen to 60 milliliters. And then I'm going to don my clean gloves. While I'm donning my clean gloves, I'm also going to get ready to assess which layer I will be using. So I'm going to cover and have my patient sniff both nostrils. Okay, so today I'll be using the right. And then I will verbalize that after I have done that, I would wipe the center of the nose with either alcohol, prep, or soap and water and pat dry. And then the next part of my procedure would be to measure my NG tube, but that has already been done. So next I am going to get ready to place a towel onto their abdomen. Place a towel on their chest and place a bowl on their abdomen to catch any emesis just in case. And then next I'm going to take this and I'm going to coil it around my fingers. I would also state that I would have prepared my tape back at the other step, but I already had it prepared for my video. So I'm going to take it, wrap it around, I'm going to let it go. And I'm also going to state that I would lubricate the first 4 inches with my solution on my packaging. So now I'm going to get ready to go in to my nose. So I'm gonna come in here and I'm going to have my patient tilt forward, and I'm going to be turning at 180 degrees while I'm doing so. And once I reach the nasal pharynx, I am going to have my patient say that I'm going to tell them that they can relax and that they can either dry swallow or take a sip of water with the cup that I have placed there. And then I'm also going to state that if the patient begins to cough then or show any signs of respiratory distress, then I would stop and I would reposition my tubing into the posterior nasopharynx until they become stabilized. And after they become stabilized, I will have them swallow again. So next, once I reach my placement, I am going to grab a piece of tape to secure against the cheek. And then once that is secured against the cheek, I will also state that during this procedure, I would have placed a pulse oximeter on my patient to monitor their oxygen saturation. And once I have placed it on the cheek, I'm going to use my pen light to assess for correct placement, and also use my tongue blade. And then after that, after I use my tongue blade, I will also assess for correct placement by aspirating gastric secretions or using the pH or x-ray. And then after I have done that, I would get ready to remove my temporary tape and get ready to place my permanent tape. So I'm gonna get my permanent tape in my hand. If I can get it to stop sticking to my glove. I'll get ready to remove. And then place it across the nose. Okay. And then once I have done that, I will have also connected my 60 milliliter syringe to the end of my tubing. And I'm going to state that now I will be going to low intermittent suctioning. And then, so I'm going to place this here, and then I'm going to take this out. I will also have make sure that this was kinked. And then I'm going to place this back in. And I'm going to verbalize that the blue pen tail would be placed above the stomach, and that a indwelling marker or pen would be used to note the exit site of the tube for displacement. And then after I have done that, I am going to connect this to suctioning. Like so. My tape has apparently come up, but I will state that that has been noted, and I will place this above the stomach. So once I have done that, after that has been placed and everything, then once I have completed my procedure, then I'm going to get ready to position the call light in reach, lower the bed back down, and then lower the bed down, raise the side rails back up, and then assess patient for comfort. And then I'm going to raise the head of the bed no lower than 30 degrees. I'm going to remove the towel and everything. And then I'm going to get ready to go and document that the size of the NG tube used, if suction was used, how the patient tolerated the procedure, the color, amount, and characteristics of the secretions, how the correct placement was assessed, and everything. And then after that, as far as discontinuing the NG tube. I would come into the patient's rooms, I would verify order, I would explain the procedures to the patient, I would perform hand hygiene, and then I would auscultate for bowel sounds, and then I would disconnect from the gown. And once I disconnected from the gown, I would ask the patient, I would turn the suction off. I would ask the patient to get ready to breathe and breathe and hold while I get ready to remove the tube. And I'm also going to make sure that it is kinked before I remove the tube. So here, and I'm just going to slowly come out. And then at the end, I would get ready to document the amount of secretions that came out, and then I would get ready to perform oral care and go document, and that is the end of my procedure.